Firstly, thank my honorable teacher to give me opportunity to say something about my presentation topics. And I am Shahadar Rashid Meju, my ID 181291193. And my presentation topics, drug combination and their efficacy for cancer. Now I discuss my presentation topics. Cancer. Cancer is a large group of disease that start in almost any organ or tissue of the body when abnormal cells grow uncontrollably. There have many symptoms of cancer. If I say abnormal periods or pelvic pain, change in bathroom habits, bloating, breast cancer, chronic headache, difficulty swallowing. Now I discuss abnormal pain or pelvic pain. Most women have them occasionally irregular periods or cramps, but persistent pain or change in cycles can be a sign of cervical bloating. We all feel bloated now and then, but bloating for more than 2 weeks can be a sign of ovarian cancer. Breast ends. This includes a new lump, dimpling, discoloring, change around the nipples, or unusual discharge. This is common occurs in women breast cancer. Now I discuss frequented fevers or infection. Speaking fever and overem, going from one infection or next can indicate an immune system that's been rendered more susceptibility by lymphoma or leukemia. Now I discuss stomach pain or nausea. Unusual discomfort that lasts then 2 weeks can be worrying sign of liver, pancreatic or various digestive systems cancer. Now I discuss drug combination therapy. If I say combination therapy is a therapeutic intervention in which more than one therapy is administered to the patients. If I say example of combinations therapy include treatment regimens that involve administration several separate pills, and yeah, there have examples of drugs. If I say fast drugs, imnefenji, ivinfishon, and tremelimumab. Now I discuss clinical trial results, their combinations. In the primary analysis population of patients whose blood TMB was 20 or more mutations per megabase did not meet the primary endpoint of improving overall survival compared to standard of care platinum-based chemotherapy. The safety tolerability profile for the combination of ineffigy and tremelimumab was consistent with previous trials. Now I discuss efficacy drug. It is a capacity to produce an effect. Efficacy can assess accurately only in ideal conditions. Thus, efficacy is measured under expert supervision in a group of patients most likely to have response to drug, such as in controlled clinical trial. Now I discuss cytotoxic drug. Cytotoxic drug inhibits cell division, and this causes cancer cells to die. Two cytotoxic drugs are transported in the bloodstream throughout the body. Cytotoxic drugs can be used to destroy tumors, boost outcomes, and the surgery of radiotherapy. Now, last topics. I discuss rules of drugs. The more diversified the drug type have, the more integrated benefits the therapy and might gain and achieve. However, if we can know the drug sensitivity testing of cytotoxic or anti-cancer drugs and the drug response of cytotoxic anti-cancer drugs is a specific tumor species by detecting cancer and biomarkers may we have better therapeutic outcome. And this is my short presentation. Assalamu alaikum.